The province of Manitoba has declared an HIV a public health emergency. It follows the highest and fastest growing rate of new infections in Canada. The province's chief public health officer made that declaration just a short time ago in Winnipeg.
Manitoba continues to experience some of the highest rates of HIV in Canada. In 2024, we reported a rate of 19.5 cases per 100,000, which was roughly 3.5 times that of Canada's rate of 5.5. So HIV rates in Manitoba have sharply risen over the last number of years. In 2025, there were 328 new cases reported. If we compare that to 2021, we saw 142 cases that year.
And the CBC's Cameron McIntosh was watching that news conference. He joins us now live from Winnipeg. So what more can you tell us about this emergency?
Well, Arthur, you just heard Dr. Roussin there talking about the highest HIV rates in Canada per capita, about 19.5 cases per 100,000 compared to 3.5 cases per 100,000 for the national average. So what's driving this? This is something that we've really seen play out throughout this decade, the 2020s, where in 2019, Manitoba was reporting about 90 new cases a year. Now it's over 300. So where we're seeing this growth is in the north and in Winnipeg. We're seeing it among intravenous drug users. We're seeing it in people that are homeless, and we're also seeing it in mental health issues. All of these problems that disproportionately affect the Indigenous population here in Manitoba. So we're seeing the HIV rate particularly skyrocket within the Indigenous population and Indigenous women that are making up more than half of these cases. So what Manitoba is doing today is basically declaring this state of emergency to free up some resources to help counter this, but also to drive a message of awareness within those communities. Here now is more from Dr. Brent Roussin.
So our focus is going to be on reducing new infections, improving access to care, supporting people living with HIV, and addressing the conditions that continue to drive transmission within Manitoba. So this emergency, it's not about creating fear. It's about acknowledging the reality that individuals and communities are facing right now, and to address that with a level of urgency.
So when you're talking about mental illness, you're talking about homelessness and drug use, these are issues that really do vex society, not only here in Winnipeg or in Manitoba, but across Canada. The main message in this right now is education, getting the message out within communities that are affected here.
Now, what did we hear from the province on what actions they're taking to combat the growing number of cases?
Well, we live in an age where HIV is effectively preventable, right? Pre-exposure prophylaxis have a success rate of about 99% with non-infected HIV, people that are perhaps exposed to an HIV environment but themselves are not infected. So people that may have an HIV positive partner, again, intravenous drug users. Manitoba is making more of those available, and more importantly, trying to get the message out to people that those drugs are available and get people to trust them and to take them. So that's going to be a big part of this. Another part of this is going to be testing, getting people tested within their communities, getting people wanting to get tested, taking away the stigma of all this. Of course, HIV and AIDS has long been wrapped up in stigma. What the province is trying to do here is, again, hit that public education aspect of this to try to get people to not be scared to get tested. Better to know, the message being better to know than not know, and perhaps spread this even further. So those are the main fronts on this. Again, this has been a growing problem per capita in Manitoba for the better part of the 2020s, particularly here in Winnipeg and in Manitoba's north. Manitoba now really trying to hit that education message.